This special report was recorded at the AMA House of Delegates meeting on June 16, 2009. For continuing coverage or to listen to President Obama's speech in its entirety, please go to www.reachmd.com.
This is Dr. John Armstrong, a trauma surgeon from the University of Florida in Gainesville, and you are listening to ReachMD XM 160. We are here at the American Medical Association House of Delegates meeting the day after President Barack Obama presented to America's physicians and all citizens his vision for health system reform. And we're privileged to be here with two members of the American Medical Association Board of Trustees, Dr. Stephen Stack, an emergency medicine physician from Lexington, Kentucky, and Dr. Samantha Rosman, a pediatric emergency medicine fellow in Cambridge, Massachusetts. Both have been heavily involved in reform efforts related to health information technology and health system reform. Welcome to the program.
Thank you.
Thank you.
Well, clearly, President Obama wanted to share his aspirations for health care in America. And Dr. Rosman, what did you hear in his speech that you think will resonate with America's physicians?
I think what we heard in Obama's speech to the AMA yesterday was a firm commitment to achieving health system reform that provides access to quality medical care for all patients, that allows doctors to keep their practices open and serve patients in the way that they went into medicine to serve. We were very excited to see his commitment to health system reform. He's bringing together people from across the aisle, and we look forward to working with him further. It is a top priority for the AMA to achieve coverage for all Americans so that they can access the care they need.
Were you surprised that he took the angle of economic toll that healthcare is taking for America?
Not at all. I think that we as physicians and our entire country sees every day the skyrocketing health costs, and it's just not sustainable. Costs are growing at an alarming rate, and they already make up 17% of our GDP, and as a country, we won't be able to afford it. We need to contain costs so that we can provide care to everyone and get them the care that they need.
So 17% of our gross domestic products. You found the argument compelling that we have to do something.
Absolutely. If we don't address health costs, we won't be able to provide all Americans with the care that they need to stay healthy and get the access to care when they get sick.
Well, Dr. Stack, President Obama started his speech by highlighting areas where he feels there's widespread agreement. And one of those areas relates to the need for health information technology that makes patient medical information accessible throughout the system so that we've got all elements of the system working together for patients. What does the American Medical Association think about that?
The American Medical Association believes that health information technology could be an invaluable tool to provide better care and more reasonable care to patients. It seems somewhat farcical that in today's world we have secure access to banking information regardless of where you are in the world, and can take money out of an ATM machine or manage your bank accounts. But physicians and hospitals can't communicate patients' information between each other in a way that facilitates their care and helps us to provide the best quality of care. Health information technology offers a great deal of promise, but it's not a silver bullet. And it's important that we remember that health IT is a means to an end, and that end is high-quality care for patients. So we stand alongside the President in support of health IT as being one of many positive steps we can take forward. The devil, of course, is in the details, and we have a lot of work to do to build that system in a way that works for patients and the physicians who care for them.
Now, he did reference funding for health information technology in his recovery package for America. Do you think that's enough to actually bring health information technology to all physician practices in America?
I think that the American Recovery and Reinvestment Act and the money that it puts on the table is the first meaningful investment, a big down payment, if you will, to get us in the right direction. In and of itself, it is certainly not enough to get the job done, but it is a great first step, and hopefully, if administered properly and well, will get us farther down the path than we ever had the chance for before.
Now, you're both in emergency medicine. Another element of what President Obama talked about was putting preventive care into the healthcare delivery system and really getting healthy behaviors. I would imagine that in emergency medicine, you see some of the consequences of high-risk or unhealthy behaviors. Do you see a commitment to reshaping this healthcare delivery system for prevention? Do you see that having an impact in emergency medicine? Dr. Stack?
Absolutely. I think that what the president showed is that perhaps more than any president in recent history, that he and the team that he's put together have a better grasp and a better appreciation for the complexity of the issues we have to address, and also more of a willingness to candidly discuss topics that are difficult to discuss. There's a great deal that the healthcare delivery system needs to work on to do a better job, but we can't do this alone, and at the end of the day, it really is all about the health and well-being of our patients. By virtue of the president identifying that healthy lifestyles and personal responsibility are going to be essential, and that without those there is no hope for success of healthcare reform, I think the president has demonstrated and said very clearly that he understands that Americans have to share in this responsibility and work hand in hand with their physicians to make the system better for all of us.
And Dr. Rosman, did you hear in the same line with an emphasis on prevention a commitment to pushing efforts at prevention out to the children of America?
Absolutely. I think that President Obama understands that we need to keep our children healthy in order to keep our entire society healthy. In the emergency department, we see kids who haven't been vaccinated falling ill with completely preventable diseases, or kids barely in their second decade of life already suffering from obesity and therefore diabetes. We absolutely need to address prevention. We need to make prevention stronger in our system. We need to make sure that it's covered and that patients have access to that preventive care to stay healthy. And we were very excited to hear President Obama putting an emphasis on prevention because we do feel that's a critical part of health system reform.
Well, then President Obama moved on to some other more controversial elements. What were you surprised to hear him articulate yesterday?
He was the first Democratic president who has really brought forward a commitment and expressed an understanding of the challenges we face with medical liability. Although we may not agree on all of the pathways to get to true medical liability reform, I think that we were happy to hear him address the issue and call attention to what a big part it does play in medical practice. Every day in the emergency department, there are tests ordered because we are afraid of being sued if we don't order those tests, and that leads to increased cost. It leads to complications from the testing that we do, and we need to address defensive medicine. We were very glad to have President Obama bring forward that issue and a commitment to work with it. We clearly have a long way to go to find a solution that works, but we were excited to hear him bring forward the issue.
And yet, Dr. Stack, that was the part of the speech where there was a smattering of boos. And I was present for the speech. These, in my mind, were not catcalls. These were, in essence, canned boos, anticipated when he said that he did not support caps. Did you hear a commitment from President Obama that he has some solution to the issues of defensive medicine?
Well, first, I want to thank you for bringing this topic up because I think the mainstream media has done a gross disservice to the public following it and misrepresented that dialogue between the physicians of America and the president. That boo, I think, was taken in the sense that it was intended, which was a sincere response back to the president that this is really important and fundamental to reform of the system. And the president, with a chuckle and a smile, took it as such. And that, in fact, is a good demonstration that there was a dialogue taking place in that room. The president, as Dr. Rosman said, has for the first time from a Democratic president acknowledged that liability reform in a grossly out-of-control tort system is an absolutely essential reform element in these dialogues and has put on the table the willingness to discuss various options. He was also very clear which options he felt were not going to be on the table, which would be blanket caps on damages awarded to patients or plaintiffs. However, there's an array of options that are not caps on liability judgments, and he very clearly stated that he is willing and open to dialoguing on a host of other possibilities. I think the president deserves praise for taking on what is a very difficult topic and being willing to discuss that with us, and I think the House of Medicine appreciated that for the positive comment it was.
Dr. Rosman, as a spokesperson for the association with regard to health system reform, did you hear President Barack Obama endorse single payer yesterday?
President Obama actually not only did not endorse single payer, but addressed the fears that people have that this may be a slippery slope to single payer. He said that is not our intention at all. Our intention is to create a broad system with options that will work for everybody. And we were not surprised at all. That is what he's expressed in the past, and we believe that he really understands that we have a diverse country. We need a diverse suite of possible solutions so that each family can choose the option that works best, that covers themselves and their families.
As he was enlisting the aid of the American Medical Association, he issued a clarion call, "I need your help, doctors." And in reflection now, what message would you each share with the members of the American Medical Association and all physicians in general about what physicians can do to help move health system reform forward? Dr. Stack?
The biggest message I'd like to give to the doctors of America is that the President, I believe, and I take him at his word as sincere, they do need the work of physicians and our input for this to be successful. And physicians should rise to that call and become engaged in this dialogue and attend to the details and become educated on these topics and not believe every soundbite they hear, but really dig into the substance and become involved and become the physician leaders in their local communities and in the broader community that the public expects of us. I think this is a historic moment. I think we as a profession have a chance to demonstrate the true commitment we have to the health of Americans, and I look forward to this year, and I hope for us all that we're able to arrive at success at the end of the journey.
And Dr. Rosman?
I think Dr. Stack said it well. We heard from President Obama that he does need the doctor's help. And that's because as doctors, we are intimately involved in the healthcare system. We see the problems and the cracks in the healthcare system affecting our patients every day. And we need to be there advocating for the best care for our patients. I think as Dr. Stack said, we need to get beyond the fear tactics, beyond the politics, beyond the labels, and come together and really work with the administration and with Congress to find a solution that works for doctors, but most importantly, that provides all of our patients with access to quality medical care.
What I hear you saying, I think, is that we keep patients focused as the real driving force behind reform, and in essence, we ask physicians to become community activists, if you will. Turns out being a community activist can take you pretty high places. Well, it's been a real privilege to be here with Dr. Steve Stack and Dr. Samantha Rosman, both emergency medicine physicians from across the country, leaders in the American Medical Association, young physicians who are making a difference. Thank you again for being here.
Thank you so much for having us.
It's been a pleasure. Thank you, John.
You've been listening to a special report recorded at the AMA House of Delegates meeting on June 16, 2009. For continuing coverage or to listen to President Obama's speech in its entirety, please go to www.reachmd.com.